after a surgery, it's common to the patient have some complications. So it's necessary as nurses to observe the signs and symptoms. Like the patient can have diarrhea, can have vomiting, and also some hemorrhagia, internal hemorrhagia and external, and can also have polyuria. So it's necessary to be attentive to those factors. We need also check the patient's daily weight and some signs of it, as it can be the increase of skin turgor, can be some exams. We need to check them every day at the same time with the same amount of clothes. Why? Because with maybe can have some alteration on it and we will notice about. We need also with the lab results check another symptoms as thirsty. In old person, we must not rely on this symptom because old people have like a lot of sensation on it. We need also observe the dry mucous membranes. We need to observe signs in the eye mucosa. We need to observe the fingernail too, and many exams as electrolytes, serum electrolytes test. We need to observe the bone. We need to observe the bone or creatine and many others. For physical assessment of the skin turgor, we need first we will choose a better area for it. We can use the area below the clavicle. We must use the area of the sternum and in the abdomen. In this case, the patient did a surgery in the left arm, so I choose the right arm. So in this case, I use the forearm. I will, with my thumb and my forefinger, pinch a fold of skin. It needs to be resilient, move easy, and when I release the pressure, needs to return quickly. If don't, the patient may has dehydration. But in areas with the dorsal of the hand, it cannot be realized at the pinching because it's a thin area and maybe loose. So, and other person's shoe, we need to be careful. We need to have caution about that because the skin of this patient, those patients are inelastic according by age, and these people have disposition to some diseases as diabetes, and you cannot pinch the skin like that. First of all, it's necessary to ask the patient for permission to realize the method. So, for physical assessment of dehydration, we must apply pressure on the fingernail like that for 5 seconds. Then we will release the pressure and observe the color of the fingernail. If it turns between 1 to 3 seconds, it's normal. If it takes more long time to return to its original color, the patient has dehydration.